Welcome to Module 2 Drugs, Nomenclature, Classification, Administration of the course Pharmaceutical and Medicinal Chemistry. Chapter 2.2 is about classification based on therapeutics. The instructor of this chapter is Dr. D. Sravani, Assistant Professor in Chemistry, St. Joseph College for Women, Autonomous, Visakhapatnam. Learning outcomes. By the end of this chapter, students will be able to classify the drugs based on therapeutic action, comprehend the therapeutic effect, correlate the drug with its biological effect. The contents of this chapter are therapeutics, classification based on therapeutics, chemotherapeutic agents, types of chemotherapeutic agents. Let us first discuss about therapeutics. What is the definition of therapeutic? The branch of medicine concerned with the treatment and care of the patient for the purpose of both preventing and combating disease or alleviating pain or injury is called therapeutic. The term therapeutic comes from the Greek therapeutikos, which means inclined to serve. Different types of therapeutics are biological therapy, surgical therapy, non-surgical therapy, radiation therapy, psychotherapy, and drug therapy. In our entire course of pharmaceutical and medicinal chemistry, we are only focusing on drug therapy. Based on therapeutic usage, drugs are classified into chemotherapeutic agents and pharmacodynamic agents. First, we will discuss about chemotherapeutic agents. What are chemotherapeutic agents? Drugs which are used in the treatment and cure of specific diseases caused by microorganisms are called chemotherapeutic agents. What is chemotherapy? Chemotherapy is the treatment of disease by chemicals which act on microbes and inhibit their growth and reproduction. Chemotherapeutic agents are administered through eternal. Eternal means drugs are administered through gastrointestinal tract. Then parenteral means drugs are given other than the digestive tract and other miscellaneous routes. Then coming to the types of chemotherapeutic agents. Chemotherapeutic agents are further classified into antimalarials, antibacterials, antiprotozoals, anthelmintics, antiseptics, antifungal agents, antineoplastic drugs, organometallic therapeutic agents, anti-leprosy drugs, and anti-tubercular drugs. The first type of chemotherapeutic agents are antimalarials. Malaria is a disease transmitted to human by female Anopheles mosquito. The drugs which cure or prevent malaria are called antimalarials. They act by inhibiting the different stages in the life cycle of the malarial parasite. This is the life cycle of malarial parasite. The common anti-malarial agents are chloroquine and mefloquine. These are the structures of chloroquine and mefloquine. The next type of chemotherapeutic agents are antibacterials. Before going to the definition of antibacterials, generally we consume foods which have antibacterial activity. Those are honey, garlic, turmeric, coconut oil, and fermented foods. Let us go to the definition of antibacterials. An antibacterial drug represents a chemical substance derived from a biological source or produced by chemical synthesis, which can destroy or inhibit the growth of disease-causing bacteria. They are subgrouped as natural, synthetic, or semi-synthetic based on mode of development. Antibacterials are further classified into sulfa drugs and antibiotics. Let us discuss sulfa drugs. Sulfa drugs are synthetic chemotherapeutic agents that contain sulfonamide group, that is SO2NH2, in their structure and are widely used for curing bacterial infections in humans. The commonly used antibacterial drugs are sulfanilamide and cephalosporin. These are the structures of sulfanilamide and cephalosporin. In sulfanilamide we have SO2NH2 group, and in cephalosporin we have S and amide group also. The next type of antibacterials are antibiotics. Antibiotics may be natural or semi-synthetic. They are antimicrobial agents that can act on bacteria and reduce infections. They usually kill or retard the growth of bacteria. Metronidazole and tetracycline are used as antibiotics. These are the structures of metronidazole and tetracycline. In metronidazole we have imidazole ring, and in tetracycline we have 4 cyclic rings present in the molecule. The next type of chemotherapeutic agents are antiprotozoals. Antiprotozoal agents destroy protozoa or inhibit their growth. They include anti-amoebic, trypanocidal, means effective killing trypanomase. What is trypanomase? Trypanomase is a single-celled protozoa. Then anti-trichomonosis. What is trichomonosis? That is a sexually transmitted disease caused by parasite. And anti-malarial. Commonly used antiprotozoal drugs are xenophon and idoquinone. These are the structures of xenophon and idoquinone. In both the structures, the common molecule is quinoline. The next type of chemotherapeutic agents are anthelmintics. Before going to the definition of anthelmintics, we saw children suffering from this type of disease. This is because of some earthly worms are transmitted into intestines by their fingers through the mouth, which causes stomachache and enlarges the size of the stomach. Most commonly, intestinal worms are tapeworms, roundworms, pinworms, and hookworms. Let us go to the definition of anthelmintics. Anthelmintics are drugs that fight against infections caused due to parasitic worms. Dichlorofen drug is used in the treatment of infections caused by any tapeworm. Albendazole is used in the treatment of infections caused by poor tapeworm. These are the structures of dichlorofen and albendazole. The next type of chemotherapeutic agents are antiseptics. Before going to the definition of antiseptics, naturally occurring antiseptics are tea tree oil, eucalyptus, lavender, grapefruit seed extract. In our daily life, we are using some antiseptics like isopropyl alcohol, hydrogen peroxide, potassium permanganate. Let us move to the definition of antiseptics. Antiseptics are chemical agents applied on the surface of the skin to reduce the microbial count. They decrease the risk of surgical infections and are also used for dressing wounds. Idol and chlorhexidine are used as antiseptics. These are the structures of idol and chlorhexidine. Chemotherapeutic agents are antifungal agents. Before going to the antifungal agents, mushrooms are the fungi. Pityriasis versicolor, feet fungal, and thrush are the different types of fungal infections caused by different fungi in humans. Antifungal agents. An antifungal drug selectively diminishes fungal pathogens of a host with minimal toxic effect. Antifungal drugs are divided into polyenes, azoles, allylamines, and echinocandins. These are the structures of clotrimazole and 5-fluorocytosine used as antifungal agents. Before going to the next type of chemotherapeutic agents, we will discuss about cancer. Cancer is the second cause of death across the world. This cancer is caused by uncontrolled replication of defective cells. This is the normal cell and this one is the cancerous cell. One of the most occurring cancer across the world is lung cancer. These are the different stages of lung cancer. Coming to the anti-neoplastic drugs. Anti-neoplastic drugs act on cancerous cells and block the replication process. They are also known as anti-cancer, chemo, and cytotoxic drugs. They can be used as liquids or pills. Chlorambucil generally used in treatment of chronic lymphocytic leukemia. This cancer is related to blood and bone marrow. And uracil mustard is used in treatment of non-Hodgkin's lymphoma. This cancer begins in lymphatic system. Lymphatic system is the body's germ fighting immune system. These are the structures of chlorambucil and uracil mustard. Next type of chemotherapeutic agents are organometallic therapeutic agents. Organometallic compounds of arsenic, antimony, bismuth, mercury, cadmium, and gold have been used in medicines. These are used as anti-infective agents because these are more toxic to parasitic organisms than to the host immune system. Few salts of crocodilic acid are used for the treatment of anemia. Cisplatin is a organoplatinum compound used in treatment of cancer. These are the structures of crocodilic acid and cisplatin. The next type of chemotherapeutic agents are anti-leprosy drugs. Before going to the anti-leprosy drugs, we will see about leprosy. Leprosy is an endemic disease. It is also known as Hansen's disease. It is a long-term infection by bacteria Mycobacterium leprae. This infection can lead to damage of the nerves, respiratory tract, skin and eyes. Anti-leprosy drugs. The anti-leprosy drug is used in curing leprosy caused by Mycobacterium leprae. A drug called dapsone along with a combination of rifampicin and clofazimine for medicine of leprosy. Anti-leprosy drugs are diamino diphenyl sulfone and ofloxacin. These are the structures of diamino diphenyl sulfone and ofloxacin. The last anti-tubercular drugs. Antituberculosis is a bacterial infection that mainly affects the lungs and can also affect any part of the body. This disease is caused by the spread of Mycobacterium tuberculosis and Mycobacterium bovis tuberculosis. Anti-tubercular drugs are para-aminosalicylic acid and isonicotinic acid hydrozide. These are the structures of para-aminosalicylic acid and isonicotinic acid hydride. In this chapter, we discussed about drugs classified based on the therapeutic usage, chemotherapeutic agents, classification of chemotherapeutic agents, and 10 types of chemotherapeutic agents for different types of common diseases caused by different microorganisms. Thank you.